want to look your best. You watch your diet and eat wisely. You spend hours exercising and going to the gym. You do all the things you know you should be doing to create and maintain the body shape you want, but sometimes it's not enough. Even though you're healthy and fit, heredity may have other plans for you. Localized fat deposits can take away from the proportions you work so hard for, leaving you feeling less confident with lower self-image. Liposuction is an elective cosmetic surgical procedure that removes excess pockets of fat that don't respond to other methods. It is used to contour your shape, giving you better proportions, a better overall appearance, and perhaps most of all, better self-image. This presentation will give you a general overview of liposuction, or lipoplasty. It is not a substitute for a complete consultation with a qualified surgeon. A complete consultation will include the discussion of your goals and expectations for the procedure, an evaluation of your specific situation, a recommended course of treatment, and a discussion of potential risks and complications. Any questions and concerns should be addressed during the consultation. Full disclosure of your health history is important to your safety. This includes any history of medical conditions or illnesses in your family, your current use of any medications, vitamins, or herbal supplements, as well as any alcohol, tobacco, or drug use. Good candidates for liposuction are healthy men and women with no life-threatening illnesses. You should be close to your ideal weight, with good eating and exercise habits. Healthy skin with good elasticity and firmness will better conform to new contours following the procedure. A positive outlook and reasonable expectations are also important. Patients who smoke are at increased risk of poor healing. They are advised to stop smoking for several weeks before and after surgery. Other procedures, such as neck lift, breast procedures, tummy tuck, and body lift, can be performed in conjunction with liposuction. Additional procedures increase the duration and complexity of surgery and should be carefully considered and discussed with your surgeon. Prior to your procedure, you will be asked to sign informed consent documents. These are used to make sure you fully understand the procedure, including any risks and complications, and that you commit to following any and all instructions you are given. These include pre-surgical considerations, day of surgery instructions, and information relating to the use of anesthesia. Liposuction removes fat from many different sites on the body: beneath the chin or submental, the upper and lower abdomen, the male breast, the female breast and underarm region, the upper arms, the back and flanks or love handles, the hips, thighs, and buttock regions, including the knees, calves, and ankles. Small incisions are made in or near the areas where excess fat will be removed and new contours created and shaped. Generally, a hollow tube called a cannula is inserted into each incision to loosen fat deposits and sculpt new contours. A powered suction device called an aspirator is used to remove the loosened fat. Liposuction techniques are categorized by the amount of fluid injection and the mechanism of the cannula. During the procedure, a volume of fluid is injected into the selected area. This fluid contains lidocaine as a local anesthetic, adrenaline to contract blood vessels and minimize bleeding, and a saline solution. This fluid helps to loosen fat cells and reduce bruising. Different procedures call for different volumes of fluid. Once loosened, fat cells can be removed using different techniques. Manual suction uses no power. A syringe is attached to the cannula and fat is withdrawn manually. This technique is most often used in smaller areas like the face, or used to harvest fat for grafting. Ultrasound-assisted liposuction, or UAL, uses a specialized cannula which transmits ultrasound vibrations within the body. This vibration bursts fat cells, liquefying them, making them easier to suction out. Power-assisted liposuction is similar to ultrasound-assisted liposuction. A specialized cannula with mechanized movement is used. This reduces the amount of manual movements the surgeon must perform. One or more areas of the body can be treated in a single liposuction session. Removal of 5 or more liters of fat is considered a large volume and may require special considerations and precautions, including an overnight hospital stay. You should begin light walking as soon as possible. This should happen every few hours in the days following your surgery. Depending on the size of the cannula used, your incisions may be small enough that no sutures are needed. A large amount of fluid must drain out, and some surgeons may choose to leave the incisions open or only partially sutured. Unimpeded drainage can allow the incisions to heal more quickly. In any case, dressings need to be changed often while fluid is draining. After a few days, self-adhesive bandages should be enough. Any non-absorbable sutures will be removed within 5 to 10 days. A compression garment may be worn for a few weeks to reduce swelling, provide support, and help the skin conform to your new body contours. Swelling will continue to resolve for several weeks to months. If skin doesn't conform to the new contours, secondary procedures may be necessary. Bruising, swelling, soreness, and numbness are all common side effects with liposuction. Skin may also feel more firm than normal. Any discomfort or pain you feel can be controlled with medication. As with any surgery, possible complications may arise. These include infection at the surgical site, pigment irregularities, skin or nerve damage, uneven contours, fat clots and blood clots, fluid loss or accumulation, and poor healing at the incision site. Although very rare, the puncture of internal organs is possible. The use of anesthesia in any procedure presents its own risks. The use of ultrasound-assisted liposuction carries the additional risk of thermal burn or heat injury. Although you'll see noticeable difference within days or weeks of surgery, the final result of liposuction will take from 1 to 6 months as swelling resolves and your new contours take shape. Maintenance of these results is achieved through good eating habits and regular exercise. Proper and diligent sun protection during the first year will help prevent pigment irregularities. When eating right, exercising regularly, and having a positive attitude doesn't get you quite where you want to be, liposuction is the procedure that can help you reach your goal and give you the improved body image you are striving for.